The symptoms of endometriosis and its associated difficulties attached to it comes in a very, very long timeline. Mostly it starts with the first ever period a young woman, young kid may have. That is pain. Painful period is the most prominent symptom of endometriosis. The emotional and the personality that develops around this is the way the woman is shaped about her attitude towards this disease, the care that she gets, the trust that she has with her mother understanding it, her teacher, the nurse, and the way she is treated with this pain becomes the core factor how that woman turns out to be in the next maybe 5 or 6 years, what becomes of that woman. It's important to note that early diagnosing disease is the single most important part to get the good treatment, best treatment result on the disease. May I say that early diagnosis, early detection is the best prevention of endometriosis. Because if we diagnose young women early and if we can treat their pain early, the long-term effects of endometriosis will be minimized. What are they? Number one, endometriosis is the number one reason for fertility problems. If we can put in number, probably more than half of fertility problems that a woman may have has to do with endometriosis. Besides the pain, probably most common ailment the woman gets is monthly gastrointestinal symptomatology, which are bloating, which are again gassy feeling, which are other referred pain, or changing bowel symptomatology. That's why most of these patients end up with gastroenterologists in emergency rooms, unnecessary appendectomies. By the time they are diagnosed, there is more than 10 years, on the average in the United States, 11 years for endometriosis patient being diagnosed from the time of their symptoms until the first excisional biopsy or visualization of the endometriosis is made. Apart from that, it's important to note these women over years get so much used to pain medications, and the level of pain medication may get them into a state almost dependency. And sometimes we see that even though you remove the disease, the scars that has been built in mind is difficult to be eradicated. And long-term therapy is needed on these patients.